Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got cool videos featuring the very latest technology, our stellar doctors, and inspiring patient stories. Okay, you play soccer, football, you dance, you're a runner, a weekend warrior, you're young, and you've got a lot of pain in your hip and it's slowing you down. Something's not right, but is the answer a hip replacement? Not necessarily. There is something much less invasive called hip arthroscopy. Here to talk about it is Dr. Brian Rebolledo. He's an orthopedic surgeon at Scripps Clinic in La Jolla, California, specializing in sports-related injuries of the hip, knee, shoulder, and elbow. And he's got a lot of experience training elite athletes. In fact, at one time, he was the assistant team doctor for the San Francisco 49ers football team. Dr. Rebolledo, thanks so much for joining us.
Thanks for having me.
So you have experience in minimally invasive arthroscopic surgery. So let's start with the basics. What is that for the hip?
So arthroscopy is a minimally invasive approach. So this is where we use poke holes around the hip to access the joint. Rather than a large incision, we're able to access the joint through small poke holes where we use a camera and instruments to address the hip.
So how does it work?
So with this model, you can see in terms of what we typically do. For hip impingement, which is something that we commonly treat, is where we address some of the abnormal shape to the hip joint. With an abnormal shape to the hip joint, you can have what's called cam impingement, where there's extra bone along the femur, and this can impact up against the rim of the acetabulum or socket. This can injure the soft tissue structures between it. In addition, you can also have overcoverage, where the socket is overlying the ball part of the hip, and that can also cause soft tissue disruption. There are others where you can also have subspine impingement. All of these can be addressed with an arthroscopic approach.
And so what is it? I mean, how does it work? You're not actually cutting the hip.
So we're not cutting the hip. What we're first doing is actually addressing the soft tissue structures within. So we access the hip through the poke holes. Using the camera and the instruments, we're able to stitch back the labrum back to where it belongs.
And the labrum is? The
labrum is a soft tissue structure that surrounds the hip that's important for stability and function of the hip. And so it's important that for us to be able to repair that, that we're able to access that joint. This is different than the way it was done many years ago, where you actually had to dislocate the hip, a big open procedure with a long recovery. So this is one that we're able to get back people a lot faster in terms of what they want to do. In terms of fixing the labrum, we also want to address why it actually was injured in the first place. And a lot of times that has to do with hip impingement. So this is where we actually take a lot of times a burr, and we're able to reshape the bone to hopefully prevent this from happening again.
What's a burr?
A burr is a device that can cut away bone. So it oscillates or it spins, and from that we can actually trim the bone down.
So you're shaving the bone?
You're shaving the bone.
Very cool. And who's a candidate for this type of surgery?
So the best candidates are those that are active, those that have really failed conservative measures and are still bothered by it. At that point, for those that actually have objective findings here based on their examination as well as their MRI, those with hip impingement related findings are probably the best suited for that. So young active patients typically.
And why would you not recommend hip replacement surgery for somebody who is young and active?
The reason why we don't necessarily recommend hip replacement surgery, if you don't have advanced arthritis, then it probably is not the most appropriate. This is the best procedure in terms of getting you back to more of a functional level. And for someone that does not have arthritis, a hip replacement would not make much sense for that patient. And so this is one, especially if we're able to repair and treat the issues at hand, we feel that we're able to make a big difference in terms of that natural history of the hip to hopefully prevent necessarily a hip replacement in the future too.
And why don't you want to do hip replacement surgery on a young person?
Well, for a number of reasons. Number one, it can be limiting in terms of what activities you can go back to. It's almost like a tread on a tire. If you are active on a hip replacement, you can wear it out. In addition, they don't last forever, and so if you're very young, you could have numerous surgeries down the road, and the outcomes necessarily for hip replacement numerous times over are not quite as good as they are the first time. So this is one where we're able to use the same parts and obviously save the patient's tissue a lot of times, which is why we do hip arthroscopy.
How long do new hips last if you have to have a total hip replacement?
The data has shown that it does last probably 20 to 25 years, and that's using the devices that we had, or the instruments that we had many years ago.
So if you're a young person in your 30s, 40s, and you have an injury, you don't want to have a new hip, because then
right.
in your 50s, 60s, 70s, you have to have another hip again.
Exactly, and also too, you don't necessarily go back to the activities that you want to. So running on a hip replacement, not necessarily recommended. Playing soccer, basketball, all the activities that you potentially want to get back to, that's not something that a hip replacement really can allow you to do. And so that's why hip arthroscopy, especially for those, again, that don't have arthritis and that are young, active, and otherwise have good, healthy tissue, we feel we're able to get those people back to what they want to do.
And this is outpatient surgery? You actually go home the same day?
Go home the same day, so people otherwise pretty comfortable. So usually we give them anesthetic at the time of surgery, and the procedure itself typically takes about an hour and a half to 2 hours. They go home soon thereafter. Most people really are not on pain meds for any extensive period of time, and otherwise on that hip right away.
And do you literally walk right out of surgery? I mean, you're on crutches walking out?
You can, yeah. Yeah, so you're able to put weight on it right away. I let you get on the stationary bike day of, and we send you home with a motion machine. So the idea is to get you moving almost immediately.
And then when can you go back to resuming, your level of activity? Let's say you're a runner or you play soccer. How fast can you get back to doing those things?
So that varies for some. The big issue is really kind of getting the muscle function back. And so really probably the first 6 weeks is really working on getting your motion. After we get your motion, then we're really working on getting that muscle strength back. So for some, getting back to the gym 2.5, 3 months in is a very good expectation. Really kind of getting back to high level activities. That can range sometimes between the 4 to 6 month range, but for some it can come much quicker.
In a couple of minutes, we want you to hold this thought. We're going to come back and talk about this in a couple of minutes. Who should not have this surgery? So hold that thought. We'll come back to it. This is really specialized surgery. I mean, there's only a handful of doctors in San Diego who do this.
That's correct, yeah. So my training was specific for this, and this is an area of sports medicine that really is for a few surgeons here that actually practice in San Diego and really throughout the country itself. But that being said, this is the fastest growing segment of sports medicine, and for that reason, it has been a very worthwhile venture for myself and for Scripps in terms of being able to bring that to San Diego.
And how do you know you're a candidate for this particular type of arthroscopic hip surgery?
So again, based on the examination, based on the physical findings, as well as the objective findings here with your imaging, that can tell us whether or not you have good healthy tissue, based upon also in terms of what you want to get back to. Those are the patients that we're looking for in terms of being able to return them back to that healthy state. And so typically it is a younger patient, typically those without arthritis, and those are the ones that we feel that we're able to make the biggest difference to get them back to what they want to do.
But let's say you're a dancer or you're a runner and you have symptoms of pain. At what point do you say, actually I really need to go see the doctor about this?
If it's been bothering you enough and it's keeping you from what you want to do, the idea is that you should probably be seen by your doctor. The fact is that if you are having long-standing hip, it usually is a good telltale sign that there is something going on within the hip. And so to ignore these symptoms, especially in terms of preventing you from what you want to do, it is time to come back into the office.
But what's the time frame on that? Because let's say you're an elite athlete, you're a runner, you're playing soccer. I mean, injuries are part of the deal.
Right.
So how do you know, actually, is it 1 week, 2 weeks, a month, 3 months?
Well, it varies for some. I usually say let pain be your guide, but if it's not responding to anti-inflammatories and you feel that it's keeping you from what you want to do, if you're not able to perform to the level that you want, it is then that time.
But this kind of surgery is also, you talk about it being, good for younger folks. This surgery also works for older folks as well, doesn't it?
You're absolutely right. So for a select group of patients, especially for the older group, we do feel that we're able to make a big difference. For one, like I had mentioned, the arthritis. If you don't have much arthritis, then a lot of times, based upon what we know from the data, this can make a big difference. In addition, we also treat abductor tears, which are actually outside the hip, which we can also do endoscopically as well. So a number of different things that we can use from a minimally invasive approach using that arthroscope.
This surgery is really starting to gain traction because in the last 10 years, you had arthroscopic surgery for the shoulder or the knee, and now it's moving as well to the hip.
That's correct, yeah. So again, this is the fastest growing segment of sports medicine, and really based upon the new technology that we've been able to develop in this area, it's really pushed this field forward. Something else that we have here at Scripps, which is pretty unique, is a new postless distractor, which is a...
What's that?
Yeah, so one of the big risks with this procedure is that typically we had you on a bed with a post to pull the leg with slight distraction in order to safely access the hip. Sometimes groin numbness was one of the complications related to this. We don't have that anymore. The fact is that we now have this new bed that's really just been released here in the last year. We're one of the few centers here on the West Coast, and we have that available here at Scripps where we don't have that complication because of this postless distractor where there is no post between the hips that could lead to that groin numbness after surgery.
Talk about the new instruments that offer greater precision in terms of this surgery.
Yeah, so with some of the instruments we have now, it's been very nice in terms of what we can use to access the hip, what we can use to repair or stitch back the labrum, and also trim down the bone. So this is all done now where these are specific instruments that are made specifically for the hip. You had made mention earlier about shoulder and knee. The very early adopters of this were using those tools. As you can imagine, those were not really meant for the hip. And so now what we have with the hip arthroscopy instruments is really made it very specific, and I think it's led to better outcomes.
And this is really one of the fastest growing areas of sports medicine, is it not?
Absolutely, absolutely. And I think for good reason, because we're starting to see the real clinical impact and outcomes for those that are coming back to what they want to do. There wasn't really a lot of answers for those with hip impingement or groin pain in the past. And so now that we're able to address a lot of these things, we've seen this play out for a number of different weekend warriors, even professional athletes, in terms of getting them back to a high functional level.
Okay, let's come back to this. We referenced this a couple of minutes ago. Who should not have this surgery?
So outcomes have been limited for those patients that have advanced arthritis. For those that have advanced arthritis, the cartilage being degenerative at that point, hip arthroscopy has not been able to make as big of an impact. Those are modest outcomes that we don't feel a patient should have to go through in order to get the relief they're looking for. A lot of times a hip replacement is probably better suited for them if they do have advanced arthritis.
So arthritis is really the key.
Arthritis is the biggest key in terms of what the cartilage looks like.
And what if the injury is really severe?
Yeah, so in certain cases where the labrum, which is that soft tissue structure that surrounds the hip, can sometimes be very damaged, and it's sometimes not even salvageable. So there are certain situations where we're not actually able to repair it based upon the tissue quality and integrity. We're actually able to replace it with what we call a reconstruction. And those are specific rare instances where the injury is so bad that we're able to replace that tissue as well.
And what would cause these type of severe injuries?
To some extent, ignoring the symptoms. The fact is that if you've had these symptoms for a long time, that labrum, which could have been torn, could be persistently becoming more and more degenerative. And so with that, this is usually long-standing symptoms that contribute to these severe injuries.
Dr. Rebolledo, any final thoughts?
Thank you very much for having me. I'm happy to be here and really share, I think, this new technology. I think we've really been able to push this field forward, and I'm excited to be a part of this as we move forward here.
The bottom line for this technology is what?
Less invasive, faster healing, getting you back to what you want to do.
Thanks so much, Doctor. Scripps is ranked #1 in San Diego and is repeatedly ranked by U.S. News & World Report as among the best in the nation for orthopedic care. If you'd like more information on minimally invasive hip surgery at Scripps, just click on the link or go to scripps.org/videos. Want more critical information about your health? We take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.